Interviewing the menarche. When asking about menstruation, we should ask about the following aspects systematically: menarche, cycle, amount of bleeding, color, consistency, pain, premenstrual symptoms, other symptoms occurring around menstruation. When asking questions about the menstrual cycle, always ask the woman how her periods were about 2 years after the menarche. We do this because it is normal for the period to be somewhat irregular for 2 years after menarche. This is important because it gives us an idea of the woman's constitutional menstrual cycle, eliminating the influence of subsequent gynecological events such as pregnancy, childbirth, miscarriage, abortion, contraceptive pill, etc. For example, a woman may have suffered heavy blood loss during childbirth and therefore develop a blood deficiency, which makes her period scanty. The scanty period in this case shows not her constitutional menstrual cycle, but the consequence of a definite cause of disease. By asking her about her menstruation 2 years after menarche, we formulate an idea of the constitutional state of her gynecological system. The age of menarche ranges between 10 and 16, with a mean at 12.8. Menarche tends to occur at a younger age in industrialized countries compared with developing agricultural societies. It is normal for the periods to be somewhat irregular for about 2 years before they settle down into a pattern. For this reason, we should always ask about the condition of the menstrual cycle 2 years after menarche. Early menarche, that is, before about 13, may indicate blood heat, whereas late menarche, after about 16, may indicate blood and/or kidney deficiency or cold in the uterus. Thank you for your attention.
Okay. Let's talk about hand tie-in meridian, Lung 1, or the Zhongfu, the middle palace. In this illustration, we see the hand tie-in lung meridian. On the anterior thoracic region, at the same level as the first intercostal space, lateral to the infraclavicular fossa, 6 June lateral to the anterior median line. We have lung 1 here up to lung 11. Lung 1, or Zhongfu middle palace, is also called the central treasury or the central residence. It is the entry point, the alarm front move point, the meeting point between hand tie-in and foot tie-in, the lung and the spleen. Metal is formed within the earth. The journey of the lung surfaces in the heavenly aspect of the body, but begins in the middle jiao, around Ren 12. Adjacent to a band of muscle, lung 1 can be a point that needs coaxing to reveal itself. This point is a precious place where the qualities of nourishment and inspiration, earth and heaven, unite. Lung 1 was seen in some traditions as the final point on the spleen meridian. This point is a reminder of the Sheng cycle, mother-child relationship of earth to metal. Middle palace implies a place of richness, as shown in this connection of spleen and lung, uniting heavenly and earthly aspects of the qi before the qi traverses the muscle upward to lung 2, or the cloud gate. The pathway echoes the filling of the lungs with breath and the gradual descent of the out-breath, a gentle arcing shape. Middle palace is the first connection with the incoming heavenly qi and is the start of a new cycle of qi within us. The nature of metal is to receive qi from the heavens and return to the inside, to the yin, condensing and regulating the pathways of animation while sustaining the heavenly connection, and all points on this meridian are seen with this filter. The lung governs the breath and is minister and chancellor to the heart, relaying the communications of the heart wherever the breath travels. Metal deals with first and last, entrances and exits. The spirit of metal, the pole, the animal soul or animating instinct, maintains our automatic rhythmic processes of life. Middle palace is the first point on the receiver of qi. The quality of qi it is able to receive and process plays an important part in our ability to present and vital in life. The Neijing mentions that in a state of health, metal endows a strong voice. Metal also deals with boundaries between first and last breaths, between where the hairs on our skin mark a boundary between one being and another, and between connection and disconnection of body, mind, spirit, both within oneself and with the heavens. Middle Palace, as a first point, initiates and carries all these aspects on the journey of the lung meridian. This point receives heavenly chi and inspiration and brings the reassurance of feeling incorrectly connected to oneself and the heavens. The quality of that inspiration will affect the body, mind, and spirit in its ability to create balance and maintain purity of connection. If the quality of inspiration and respiration is weak or contaminated, then vitality and clarity will be compromised. Use when the person is unable to perceive quality in their life or future, or if they are grief stricken, constantly disappointed, or stuck in the past. Lung 7, narrow defile, can be a good point in combination with middle palace to help release grief. So the lung chi can descend and allow a fresh intake of inspiration and reconnection with the heavenly chi. Lung 1 also reconnects with the richness of the essence that the spleen sends to the lungs. To function well in the world, both aspects are necessary. Breath and inspiration, but also nourishment and strength. In the six authorities, the lung and spleen are the yin qi, responsible for nourishment and defense. Lung 1 is the front mu point on the lung meridian. Front mu points become spontaneously tender when their associated organ is imbalanced. Because of this, some consider them mostly for acute situations. But mu means to collect, race, and list in Machocha 1989 book. And the chi of the associated Zheng Fu collects all these points. Front mu points are yin in nature and can be used in non-acute situations to nourish and strengthen the particular Zhang Fu. They can also be combined with the back shu points of the same associated Zhang Fu for a particularly reinforcing and strengthening treatment. The lung 1 regulates and tonifies lung qi, which regulates the upper jiao. It tonifies ancestral qi, stimulates descending of lung qi, resolves phlegm and clears heat. The lung often holds phlegm formed by the spleen. Lung 1 can be used to disperse fullness and stop chest pain. The lung meridian originates in the middle jiao and ascends through the upper jiao and so affects the chest. Some indications: enlivens mind and spirit, tonifies and strengthens the lung and inspiration of qi to clear excess conditions which have penetrated to the interior, resolving phlegm and clearing heat and chest pain. This entry point is the start of the energetic cycle and is where the heavenly breaths bestow their priceless gift to the kingdom via this treasury. However, all lung points help to some degree to receive the heavenly chi and to connect the person to that consciousness within. Spleen and lung connect here. Spleen is the mother of lung. This point can strengthen lung weakness, which can manifest as grief, sadness, or melancholia, and help bring meaning and purpose back into a patient's life. Commonly used when there is a block between liver and lung, lung's canopy protects the other officials. Thank you for your attention.
Differential diagnosis, both Western and Chinese medicine, for irritable bowel syndrome, or IBS. Let's start with the Western differentiation. It is a complex and chronic disorder of the lower intestinal tract with no obvious cause. Commonly begins between the ages 20 and 30 and is twice as common in women as in men. Signs and symptoms are alternating constipation and diarrhea, a sense of incomplete emptying following a bowel movement, abdominal tenderness, abdominal distension and flatulence, burping, borborygmus, nausea, emotional distress. IBS can stem from anxiety. So we have IBS with muscle tension, headache, sweating, dry mouth, difficulty swallowing, rapid or irregular heartbeat, frequent urination, irritability, poor concentration, and low libido. IBS stemming from depression will be accompanied by difficulty sleeping, dramatic change in appetite, fatigue, low self-esteem, poor concentration, restlessness, withdrawal from society, suicidal thoughts. IBS could stem from GI infection, that is gastroenteritis. So there will be nausea and vomiting, fever, loss of appetite, abdominal pain, and cramps, bloody stools. IBS could also stem from food allergy or intolerance. So there will also be nausea and vomiting, itching of the eyes, mouth and throat, hives, nasal congestion, runny nose, wheezing, difficulty swallowing, anaphylaxis if severe. Other terms for IBS include spastic colon, spastic colitis, mucus colitis, nervous diarrhea, nervous colon, nervous or functional bowel. Now let's go to the Chinese differentiation of IBS. So we have diagnostic questioning according to organ interrelationships. So it's a co-cycle relationship between wood and earth, between liver and spleen and stomach. Relative strength and weakness. IBS could be due to an earth and wood weakness. Nature of stool, small, round, and pebble-like. This is liver qi stagnation. If the stools are long and thin, this is spleen qi deficiency. If there is predominantly diarrhea with abdominal distension and discomfort, spleen qi deficiency. Predominantly constipation with abdominal pain, distension, and irritability, that's stagnation of liver qi. Alternating diarrhea and constipation with abdominal discomfort and distension. This is liver qi invading the spleen stomach, a co-cycle disorder. If there is mucus present in the stool, dampness or heat or damp heat generated from qi stagnation and or qi deficiency. The main organs involved are the spleen, if there's diarrhea, liver, if there's constipation. Etiology for IBS in Chinese medicine, emotional strain, manifested as stress, frustration, anger, bottled up hatred, worry, anxiety. Poor diet and irregular eating habits, that is, eating late at night, eating whilst stressed, excessive mental activity, chronic illness, too much sexual activity, lack of exercise. The Zhang-Fu patterns, for the excess, we have stagnation of liver qi turning into heat, liver qi invading spleen, liver qi invading stomach, dampness, phlegm dump, damp heat. Deficiency, spleen qi deficiency, spleen yang deficiency, and stomach qi deficiency. Thank you for your attention.
Let's continue our discussion on relationships among Fu viscera. The principal physiological function of the Fu viscera is to transform and convey matter. The roles in the processes of digestion of food and drink, absorption of essential substances, and discharge of waste are related and complementary. Food and drink enter the stomach. After the initial decomposition and preliminary digestion, they are transformed into chyme. The chyme is sent down to the small intestines. At the same time, the gallbladder excretes bile into the small intestine to aid in digestion. After further digestion of the chyme, the small intestine separates the clear from the turbid. The clear is composed of essential substances and fluids, and the turbid the unwanted fluids and waste products. The essential substances of the clear are transported and distributed by the spleen and other organs to nourish the entire body. Any unneeded water or fluid is conveyed to the bladder and transformed into urine by kidney qi. The urine is stored in the bladder until discharged by the action of kidney and bladder qi. The turbid is passed to the large intestine, where the large intestine absorbs some more fluid and transforms the remainder into feces and conveys it further downward, eventually to be discharged. This process of digestion, absorption, and excretion is also dependent upon the liver's function of conducting and facilitating and the Sanjiao's function of distributing and circulating. In this entire process, the Fu organs must continually receive, digest, transport, and excrete so that fullness and emptiness alternate appropriately. They function well if there is no obstruction and poorly when there is. That is to say, the 6 Fu viscera require patency to function, and in this order of the Fu organs, removal of obstruction is the same as strengthening. In pathology, in pathological conditions, the Fu organs also affect one another. For example, if there is excessive heat in the stomach, which consumes fluids, the large intestine may not be able to transport properly, with resulting constipation. Disruption of the transporting function of the large intestine can cause the stomach to fail in its lowering function. This can lead to abnormal rise of stomach chi, resulting in eructation, nausea, and vomiting. If fire blazes in the gallbladder, it can injure the stomach, resulting in vomiting of bitter fluid. Accumulation of dampness, heat in the spleen and stomach can injure the liver and the gallbladder, causing overflow of bile and resulting in jaundice. In therapeutics, Chinese medicine emphasizes that the method of unblocking the Fu organs and purging the stagnated pathogenic evils is an important principle of treatment. In recent years, integrated treatment methods from both Chinese medicine and Western medicine have been used in acute abdominal diseases. Such flexible application of the principle that the 6 Fu viscera require patency to function, which favors such methods as laxatives and purgatives to remove retained water and dissipation of blood stasis and elimination of accumulations, has produced good results. Much clinical experience has shown that these methods can enhance therapeutic effect, shorten the course of treatment, rapidly resolve the symptoms of acute inflammation, and alleviate the patient's suffering. This integrated approach has opened new prospects for treatment of acute abdominal diseases. So we see all of these in the figure next in figure 3.24. Thank you for your attention.
Diagnosis according to Zhangfu organ patterns. This time we take up kidney yang deficiency, overflowing water. When there is a significant kidney yang deficiency, it may result in the transformation and transportation of fluids becoming so poor that fluids accumulate in the flesh under the skin. In some situations, the imbalance is not limited to the kidneys and will also affect the heart or the lung. If the heart is involved, there can also be palpitations and cold hands. If the lung is involved, there will be watery, foamy sputum, coughing, and/or difficulty breathing. Kidney yang deficiency, overflowing water, can arise when there is a deficiency in one or more of the following organs: kidney, spleen, lung, and heart. Kidney yang is weakened by disease, cold food, congenital weakness, old age, exogenous cold, overwork, lifting heavy objects, standing for long periods of time, and too much sex. Spleen yang is particularly weakened by food that is cold in its energy and temperature, and cold medicine. Heart yang deficiency can have been influenced by emotional imbalances, and lung yang can be weakened by invasions of exogenous cold. Symptoms and signs: edema, especially in the legs, abdominal bloating and oppression in the lower part of the abdominal cavity, aversion to cold, lumbar soreness, weakness or fatigue, sore or weakness, puffy eyelids, cold limbs, pale or white face, sparse but pale-colored urine, swollen, pale, and wet tongue, deep, weak, slow pulse. The pulse may be relatively weak in the sure positions. If there is overflowing water that affects the lung, there can also be clear, watery, frothy sputum, difficulty breathing, shortness of breath, cough with loose, thin sputum. If there is overflowing water that affects the heart, there can also be palpitation, shortness of breath, cold hands. Key symptoms are edema, sparse but clear and pale urine, swollen, pale, and wet tongue, deep and weak pulse. If the lung is affected, watery sputum. If the heart is affected, palpitations. Treatment principle: tonify and warm kidney yang, transform and drain fluids, possibly tonify the heart or the lung. We can choose from the following acupoints: kidney 3, 7, Ren 4 and 6, 9, Do 4, bladder 20, 22, 23, spleen 6 and 9, stomach 28 and 36. If there is overflowing water that affects the lung, add lung 7, bladder 13, and Do 12. If there is overflowing water that affects the heart, add Do 14, bladder 15, Do 11, and Ren 17. Needle technique is tonifying, except on Ren 9, stomach 28, spleen 6, and 9, which should be drained. Moxa is recommended. Bladder 23, do 4, Ren 4, 6, and kidney 3, tonify and warm the kidney yang. Kidney 7 tonifies and warms kidney yang and regulates the water passages. Ren 9 and stomach 28 regulate the water passages and drain dampness. Bladder 20 and stomach 36 tonify spleen yang. Spleen 6 and 9 drain dampness. Lung 7, bladder 13, and Do 12 regulate lung qi and open the water passages. Do 14 tonifies yang. Bladder 15 to 11 and Ren 17 regulate heart qi and open the water passages. The person should avoid eating foods and drinks that have a cold energy or temperature. They will benefit from drinking ginger tea or using ginger and cinnamon in their cooking. They should avoid lifting heavy objects, standing too much, and physical strain. Men should avoid having too many ejaculations. Kidney yang deficiency, overflowing water, can be caused by spleen yang deficiency, kidney yang deficiency, lung qi deficiency, heart yang deficiency, heart qi deficiency, damp, and cold. And kidney yang deficiency, overflowing water, can result in heart yang deficiency, lung qi deficiency, phlegm, blood stagnation, damp, spleen yang deficiency, and qi deficiency. To summarize, the etiology of kidney yang deficiency, water overflowing, includes chronic long-standing retention of dampness from spleen yang deficiency, transmission from heart yang deficiency from poor constitution or emotional problems, water overflowing to heart, transmission from lung qi deficiency from exterior cold retained in the lungs, water overflowing to lungs, underlying or accompanying pathology, kidney yang deficiency, heart yang deficiency, lung qi deficiency. Signs and symptoms, edema, especially of legs and ankles, cold feeling in the legs, back, coolness, distension of the abdomen, sore lower back, feeling cold, scanty clear urine, water overflowing to heart, plus palpitations, breathlessness, cold hands, water overflowing to lungs, plus thin watery frothy sputum, cough, asthma, breathlessness on exertion, pulse, deep, forceless, slow, tongue, pale, swollen, wet with white coating. Treatment principle, warm and supplement kidney, spleen, heart yang, boost lung qi, promote urination. Acupuncture treatment, bladder 23 to supplement the kidneys, bladder 22 to stimulate transformation of fluids, Ren 9 to regulate water passages, spleen 9 to resolve damp from lower burner, 2-4 to supplement kidney yang, bladder 20 to supplement spleen, resolve damp, stomach 28 to promote transformation of fluids, and spleen 6 to supplement spleen, resolve damp, needle with supplementation, and moxa. Thank you very much for your attention.
Imbalance of yin-yang, the mutual injury to yin and yang. In their complex interaction, overconsumption of either yin or yang can, under certain conditions, lead to insufficiency of its opposite. This may result in deficiency of both yin and yang. There are two basic patterns. When yin deficiency induces yang deficiency, it is known as yin injury extending to yang. And when yang deficiency induces yin deficiency, it is known as yang injury extending to yin. It should be pointed out that the kidney stores essence and qi and contains both primordial yin and primordial yang. It is the source of yang qi and yin fluids for the entire body. Because of this, it is when yin-yang of the kidney is not in harmony that either yin injury extending to yang or yang injury extending to yin is likely to happen. Yin deficiency extending to yang. When yin essence is reduced, the production of yang qi is reduced, or yang qi loses its carrier and dissipates. In either cases, yin deficiency can lead to yang deficiency as well, so that both yin and yang are injured. For example, in the clinically common condition of liver yang ascending abnormally, the basic pathological process is the water element, which is the kidney, failing to nourish the wood element, which is the liver, so that yin is deficient and yang is overactive. But as the illness progresses, the kidney's essential qi becomes affected, and in turn, kidney yang is reduced. In addition to the symptoms of yin deficiency, there are cold aversion with cold limbs, a pallid complexion, and a deep and feeble pulse. Now let's talk about yang deficiency extending to yin. When yang qi is deficient, there is not sufficient energy for yin to transform. Over time, this results in deficiency of yin fluids. That is, yang deficiency extending to yin so that both yang and yin are injured. For example, deficiency of kidney yang causes the kidney to fail in its qi transforming function. As a result, the metabolism of fluids is impaired, causing accumulation of water and dampness and edema. As the condition progresses, yin cannot be transformed to from yang. Similarly, deficient kidney yang fails to perform the transforming function of qi, so that fluid metabolism is impaired, leading to internal accumulation of water dampness and marked edema. However, if the condition progresses, yin becomes progressively deficient because it has lost its source in the deficient yang. In addition to the symptoms of yang deficiency, there are now emaciation, agitation, and convulsions. Thank you for your attention.
Let us now discuss the kidney yang deficiency as a pattern in enuresis and incontinence. Clinical manifestations: frequent urination, nocturia, which means waking up to urinate at night, slight dribbling, nocturnal enuresis in children, incontinence in old people, pale urine, exhaustion, dizziness, tinnitus, weak and sore back and knees, feeling of cold. The tongue is pale and wet, pulse weak and deep. It is important to remember that children, apart from the enuresis, will not have any of the above symptoms of kidney deficiency. In children, therefore, the enuresis itself may be the only symptom of a constitutional kidney deficiency. Treatment principle: tonify and warm the kidneys. Points: bladder 23, do 4, kidney 7, ran 4, ran 6, do 20, bladder 28, bladder 53, 32, spleen 6, heart 7, and yin tang. Reinforcing method and moxa on all points, except heart 7 and yin tang, which should be needled with even method. The modern prescription includes spleen 6, ran 4, and bladder 23, ran 4, ran 3, bladder 23, bladder 28, and kidney 3. Some doctors alternate these two combinations of points, both with needle and moxa stick. The ancient prescription includes heart 7 and bladder 40. This is an interesting combination of points, which harmonizes heart and kidneys, regulates lower burner, and calms the mind. It is particularly suited to nervous or slightly hyperactive children with nocturnal enuresis. Bladder 23, do 4, kidney 7, and ran 4 with moxa will strengthen the kidney yang. Ran 6 tonifies qi in general. 220 raises the qi. Bladder 28 and bladder 53 tonify the bladder. Bladder 32 strengthens the bladder function and also has some general tonic properties. Spleen 6 tonifies kidneys. Heart 7 and yin tang are used for enuresis in children to calm the mind. This is necessary as children with enuresis nearly always suffer from an underlying fear and insecurity. Case history: a 47-year-old woman had been suffering from frequency of urination for over 10 years. Her urination was very frequent in daytime, and she got up twice a night to pass water. She was also slightly incontinent when jumping or coughing. She always felt very tired and was easily cold. Even in summertime, when she came for treatment, she had to wear small dance socks to keep her feet warm. as she lay on the couch to receive acupuncture. Her lower back ached and she often felt dizzy. Her memory was poor and sometimes she had tinnitus. Her tongue was pale and her pulse was weak and deep. This is a clear example of kidney yang deficiency and kidney qi not firm. The principle adopted was to tonify and raise qi, consolidate bladder qi, and tonify and warm kidney yang. She was treated initially with acupuncture and patent remedies. The acupuncture points used with the reinforcing method were selected from the following: lung 7 and kidney 6 to open the directing vessel and tonify the kidneys. This is the conception vessel. Do 20 is to raise the qi to stop incontinence. Ren 12 to tonify qi in general and spleen qi in particular. Ren 6 to tonify and raise qi in the lower abdomen. It combines well with Do 20 to tonify and raise qi to treat enuresis, incontinence, and prolapses. Stomach 36 and spleen 6 to tonify stomach and spleen. Kidney 3 with moxa on the needle to tonify and warm the kidneys. Ren 4 with moxa box to tonify and warm the kidneys. Bladder 23 and bladder 20 to tonify kidney yang and spleen yang, respectively. Thank you for your attention.